capacity and they're not able to function normally.
Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called a major depression disorder or clinical depression. It affects how you feel, think, and behave, and can lead to the variety of emotion or physical problem. You may have trouble doing normal day-to-day activities, and sometimes you may feel like life isn't worth living. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both.
Generally, you're not happy, you don't want to associate with other people, you also get problems sleeping at night, so you have insomnia, or sometimes you oversleep, you just want to sleep the whole time. Then you have problems with feeding, you don't feed well, your appetites are very low. And there are times when you feel like you want to end your life, you can become suicidal, or you just want to hurt yourself. You can have issues with anxiety. Yeah, so there are many signs that you look at to know that this person is actually depressed.
Depression is a common illness worldwide. It is estimated that 4% of the population are affected, including 5% among adults and 6% among adults older than 60 years. In the year 2021, approximately 280 million people in the world have depression.
Suicidal ideations, feeling that you want to kill yourself, is one of the signs that maybe someone has a depression. And there's that feeling of being irritable. Those people are just always not happy. They're mad at people for no specific reason. And I've talked about the loss of interest. Yes, and it is true that people who have depression can be suicidal.
Depression can lead to suicide. Over 7,000 people die due to suicide every year.
Suicidal because of the way they are feeling about their lives. They are worthless. They feel worthless. They don't have any value. So they feel like the best thing to finish that bad feeling is maybe to just kill themselves. So they may try to kill themselves, or you find that they were trying to hurt themselves in a way. So it could be a way of calling for help, like telling people, you see, I'm not okay, kindly help me. Or they're just feeling so worthless that they don't feel any need to continue living. So they decide to end their life. The first step you take when you realize that someone is depressed, of course, they need help. The first step is to be close to that person. Show your friend that you are concerned. And by showing your friend that you are concerned, it means you're trying to get some kind of help for this person. And of course, we have different types of help that you can give this person. Number one, maybe inform the family members. Maybe the person wants to hurt themselves. Inform the family members, the friends who are close to this person, to just check on him, to check on her, and make sure that they are okay. And then maybe you can advise them. You assist them seek help. By seeking help, it means that they will go for therapy. They'll go see a therapist who will decide and maybe find out whether they are really depressed. Because sometimes could be a person has other issues. They are stressed because of one thing or another, and they're able to cope. So the moment you look at a person and you see the signs that I've mentioned, the next thing is to help them. Yes, because we have various ways of interventions.
Globally, depression is one of the leading causes of disability and is a major contributor to the global burden of diseases. Recent estimation from the World Health Organization shows that over 30 million people around the world are depressed. Kenya, not an exception of this global picture, has about 1.9 million depression cases. It has been ranked 5th among African countries with the highest number of depression cases after South Africa having 2.4 million cases, Congo having 2.9 million cases, Ethiopia having 4.5 million cases, and Nigeria 7.1 million cases.
They are all very helpful depending on the stage where the person is at. Because when a person is depressed, they are not able to take care of themselves. So one option would be to take them for psychotherapy. Psychotherapy, it means they go to a counselor, psychologist, they sit down, they talk about it. The psychologist is able to assess and see. We use there is a tool that we use to measure whether a person has depression. So the person goes to a psychologist, they are talked to, and then the counselor does an assessment, psychological assessment to this particular person, client, and they are able to know whether the level they are in. Is it psychotherapy that is going to assist them? Is it medicine? Because we have medication, antidepressants that are prescribed to the people who are depressed. Or then after that, we try other methods like we have alternative methods whereby the person who's depressed, they use other ways. The other people will use yoga, maybe hypnosis, maybe they use just other ways different from medication or therapy. The alternative methods to assist them. Or they can even do a self-care themselves. Self-care means that you check your diet, you check your sleep patterns, you check the way you do your exercise, which is very important, and then you also do self-care. Self-care as in you avoid negativity, negative areas, the things that make you feel depressed, because we have causes for depression. So you try to avoid, especially those things that make you feel negative about yourself, that trigger anger, that trigger low moods. So you take care of yourself, you go out there and try to socialize more and try to make yourself mentally fit.
In Kenya, just like most resources, poor setting, poverty, and unemployment, drug abuse, especially alcohol, are among the leading causes of depression for the population. There is also an emerging trend of depression among the youth, especially those within the education system. A study looking at depression among university students in Kenya reported that out of the 923 student sample, 35% and 5% had a moderate depression symptoms and severe depression respectively, and this has significantly associated with the year of study, economical deprivation, and academic performance.
People who have physical problems automatically are prone to getting mental problems. You find people who have things like high blood pressure, diabetes, and these long-term illnesses, lifestyle diseases, they are more likely to get depression, maybe than the others. But you also have other causes of depression, because there are people who have a problem with chemical imbalance in the brain, so they are more likely to get depression. There are people who are genetically they have genetic issues that they become so likely to get depression. We call it genetic predisposition. So if you are like your family, there was someone who had depression, it means that you are likely to get the depression. Those people who are exposed to bad situations like abuse, they've been abused in childhood, they are working in places that are so depressive, they are very likely to get depression. those people who've encountered serious problems like loss and grief. We have loss and grief whereby you've lost someone, and then maybe it becomes complicated grief whereby you lose someone this time, then next time you lose another person who's not healed from the previous loss. They are likely to get depression. So the normal living circumstances, a person who lives with very negative people, they are stressed all the time, they end up losing their job. So the accumulated things, and especially if genetically you are prone to getting depression. So, and then in life you find that now you get so many other problems. So this person is very likely to be depressed, to get depression. Yes, so there are many circumstances like the biological, the chemical imbalance, the genetic factors, the environment that we live in. Yeah, they all expose you to. First of all, depression can affect anyone, even children. Nowadays, we've seen children getting depressed. There are some factors that make maybe women more prone to getting depression than men, but women can deal better than men because I think because of their nature. Women can talk, they are friends, they go there, chat, and so they are able to deal with depression better than men. The men, on the other hand, when they get depression, it's not easy for them to come out and say that I have this problem. So that is why you see very many cases of men maybe who commit suicide, men who try to harm themselves, men who go berserk and they go kill their whole family and do stuff. Yeah, so I would say that women are more likely, but they are better off in dealing with depression than the men. But depression can affect any gender, it can affect children, it can affect all. Prevention is mostly self-care, and if you're aware that maybe there was a person in your family who had depression, just take care of yourself. There is the lifestyle that we live, because I've said you find that people who have these lifestyle diseases are more prone to getting depression. So take care of yourself, eat well, balanced food, exercise, also avoid negativity, and take time to take care of your body, go out there, have fun. It's not all that serious. Go out there, have fun, take trips, take walks, associate with people who are positive so that your mental well-being can be fit. And when you feel like you are getting depressed or you have a feeling that maybe there's something which is not right, it's good to go and seek help. Seek help, find out. Then from the therapist is able to tell whether you are depressed or it's just the normal stress or what is affecting. So it's good to take care of yourself, check your friends, check your relatives, so that if you detect something from the signs that I've told you, you're able to assist them, direct them to for psychotherapy, direct them to a doctor, psychiatrist, someone who's able to assist them.